Hello, my name is Gillian McKee and I'm a palliative care nurse practitioner with Atlantic Health System. This series focuses on you as a person, not a patient. We know that this information can be a lot to process, which is why we recommend thinking about your or your loved one's preferences early, talking about them with family and documenting them as early as possible. Today's video will provide you with an overview of some medical treatments and procedures that may be used near the end of life. As the end of life approaches after managing a serious illness or condition, there may come a time when life-sustaining technology is offered. It is helpful to know what these treatments are, when they are appropriate, and how they work. Having this information in advance can help you or your loved ones make informed decisions about whether these treatments should be used or not. At the end of a progressive illness or in very advanced age, a person's heart will stop beating, signifying death. Under these circumstances, this is expected and natural death. Cardiopulmonary resuscitation, also known as CPR, is a medical procedure that uses forceful chest compressions, drugs, and the insertion of a breathing tube in an attempt to reverse death. Although CPR is often thought of as life-saving, it only works in a small percentage of cases and can sometimes cause permanent disability. CPR does not reverse the underlying issues that a patient with serious illness is facing, and in fact may only prolong their suffering. Understanding what CPR is and when it's a good choice for you or your family member is important in the care you receive. Talking to your healthcare team can provide good information about whether CPR is an appropriate medical procedure for you in your circumstances and whether you would want it. In some serious medical conditions, it can become very difficult to breathe, and a ventilator may be an option to help you. A ventilator is a machine that does the work that the lungs should be doing. It requires that a tube be placed down the person's throat into their lungs. The machine actively pumps oxygen into the person's lungs and takes over breathing. This tube can be very uncomfortable, so it often requires medication to sedate the person. Sometimes ventilators are used just for a short period of time until a patient's temporary condition improves, but for some people with a serious condition or terminal illness, they may never be able to come off a ventilator. When patients are unable to eat or drink by mouth and swallowing is difficult, artificial feeding may be an appropriate medical option. There are various types of artificial nutrition and hydration, but the most common one is called percutaneous endoscopic gastrostomy, or PEG tube. PEG feeding requires a port to be surgically placed into the stomach wall and a tube extended from the abdomen. Special nutrition is transported into the stomach through the end of the PEG tube. Artificial nutrition may not change the outcome at the end stages of a very serious illness or advanced age, and in some cases can cause more discomfort and complications for the person. It is important to again discuss this option with your healthcare team to understand what is right for you. All of these medical procedures and treatments have a specific purpose in replacing a person's failed organ function to attempt to prolong life. However, there are certain medical circumstances where they may not be appropriate and may cause more burden than benefit. Whether thinking about your own health or advocating for a loved one, it's important to understand the treatments being offered and whether they will achieve the goal you want, and whether it is something you or your loved one would ultimately want. It is important to discuss the potential need for any of these treatments with your loved ones and your healthcare team, and to document your preferences for each so that you are able to align the care you receive with the way you would want to live. We hope that you found this video helpful. For more information, be sure to speak to your healthcare provider or visit these websites.